Hey there, I'm Dr. Burchett. I am an ER doctor and hospitalist. I went to residency in Martinez, California. I did family out there and graduated from KU Med, got my MD in 2006. I just want to give my advice to current medical students about how to do well in your classes in medical school. If I were to, you learn all these things going through, if I were to go back, what would I do? Or what would I tell myself in the beginning? The first thing that I would tell myself in the beginning about how to do well in classes is, number one, find an upper class person, so a second year or a third year, who has been through these classes at your school, and simply ask them, what's the formula? What is the blueprint to doing well in this class? So for us, for example, at KU, in pathology, it was all about old tests. Teachers handed out old tests and they had this huge question bank. And so what we would do is we would memorize the slides, because the slides would have almost all the information you needed to know, and then we would just take tests over and over and over and over, and the more questions you could see and memorize, that was the best way to prepare to doing well on those tests. But that was only pathology, so there was a different formula for anatomy, for example. So anatomy, to do well on the gross lab, you had to go in there and not only do your dissection and learn it, but then go through and see all of the other cadavers out there and identify all the things, and they would tag stuff and like a repetition of that. My point is, there was a blueprint that other people had done before, and so it is so worth it to find a second or third year, buy them lunch, and get that blueprint of how do I do well in biochemistry, pathology, gross anatomy, whatever the class is. How do you get the A in that? And then you execute on that. It's going to be different for each one. When it comes to getting into the residency of your choice, there's three things. There's your preclinical scores, there's your clinical grades, and your preclinical grades, your rotation grades, and your board scores. I don't even know what they call those damn boards anymore. Those three things are the most important thing. And then there's your personality and who you are and the experiences you've had. But really, it's the same story. It's grades and scores. I've sat on residency committee admissions, and this is what we look at, number one. So your grades, how to do well in the preclinical years, are very important to this. And I think this is the number one thing that I would do, is find somebody who's gone through it and find the blueprint and execute on that. And then the second thing I would do is just repetition. Memorize, repetition. I like to make a page and fold it. So on one page you list these things, the other page are the answers. Fold it and just go back and forth. Or just literally reading and rereading and memorizing the slide handouts. That seemed to be very effective for us. And then if you can, generate a 1 or a 2 page thing throughout the month leading up to the test that has all of kind of the key detailed whatevers on there that you can have in one place, and you can just pound it. Repetition over and over and over. So my advice is, number one, blueprint, and number two, repetition. Work in habits of repetition every day. That's how you're going to get A's in medical school. All right, thanks. Subscribe to this YouTube channel. I am going to do a video on how to do well in your clinical clerkships, because I did well in some and I didn't do well in others. And now that I'm an attending, I know what the formula is. I know what, because I've seen better and not so better students. So look forward for that one, and good luck. I hope you get the residency that you're dreaming of.